welcome to Digital Health Talks, where we explore the cutting edge of healthcare innovation. I'm your host, Megan Antonelli, founder and CEO of HealthIMPACT Live, and today we're thrilled to have Pam Saechow, founder and CEO of Ellit Groups. Pam brings a unique perspective to healthcare IT, blending her background in integrated medicine and with over 2 decades of experience. As we navigate the rapidly evolving landscape of healthcare technology, Pam's insights on recent industry developments, strategic partnerships, and patient-centric solutions are more valuable than ever. Whether you're a healthcare leader, innovator, or simply passionate about the future of medicine, you're in for a enlightening discussion. Let's dive in and explore how Pam and Ellit Groups are bridging technology and compassion to revolutionize healthcare. Hi, Pam. How are you?
Hey, Megan. So good to see you. Thanks for having me.
It is so good to see you. It's been too long. Obviously, you're joining us in New York at HealthIMPACT, but I'm so glad you are here today. And it has been quite a summer, you know?
Very hot summer.
hot both in weather and, lots of things going on in digital health. But we always start off trying, getting to know our guests. And of course, I know a lot about your story and your founder story with Ellit Groups, but share with our audience a little bit about what sparked your passion for healthcare innovation and how you got to found Ellit Groups.
Absolutely. Well, my journey into healthcare IT really began very early in my life, and it started in Laos, where my grandmother, which I know you know me very well, is a healthcare provider in our village, right? That was my first inspiration. When I moved to the US at about age of 9, I found myself naturally stepping into a role helping the Laotian community with language support and navigating the complexities of healthcare. That's really where my passion for patient advocacy really took root. I realized the weight of responsibility in helping people manage their care, often by manually guiding them through the system rather than through streamlined automated processes, is kind of where I think technology started coming to light for me. And, I steal this phrase actually to give credit to Judy Faulkner about duet. D-U-E-T used to be a phrase she used when we were learning Epic back in the early days. It was difficult on us, easy for them. And that really resonated with me, It really encapsulates the mission I strive for in the healthcare IT when I think about Ellit Groups, right? Is how do you make sure that while the systems and technologies may be complex for us to build or configure, they should always simplify the user and the patient experience.
Yeah, it's amazing. And Judy has, done so much for the industry, and that simplifying the process is a huge part of that. And I love your story about your grandmother. And I think, when I thought about this conversation and what your approach has always been, it has been very compassionate and listening. And, tell me a little bit about, what that's like and how you bring that to your client work.
For sure. I think knowing that my grandmother's practice of integrated medicine shaped my approach in healthcare IT, I do always keep, I feel, 2 key ideas at the center of everything we do, right? The duet I just mentioned to you is how can we take on the hard work in IT to make the experience easier for our healthcare providers, relieving them of some of their administrative burden. We always hear about burnouts, right? So they can focus on patient care, because you hear more and more all the stuff we introduce takes time away from their ability to see the patients and talk to the patients. The second is improving workflows from the patient's perspective. We've all been patients or loved ones who's been patient, where we sat through there in waiting rooms and trying to get results or getting access to care and getting frustrated, right? So for me, the second is truly improving those workflows from the patient's perspective. As I help the Laotian community navigate the healthcare system, I often have to personally connect with every single entry point, from overcoming language barriers to securing access to care. I think that experience really drives me to develop solutions that remove the need for manual intervention wherever possible, allowing patients to access the care they need when they need it. And I think at the end of the day, without relying on someone else to help them navigate the system, because they may not have someone like me to help them navigate their health system. And I think that really is the staple of what we bring to our organizations and clients when we're out there, really keeping those in perspective.
Yeah, it is at any point or role that you are within the healthcare system, I feel like you need a navigator. Of course, no more than the patients do, right? But,
Mhm.
it becomes, as you said, with clinicians and burnout, I mean, it is a complex and difficult place to work and to
It
be in,
is.
you know?
It
And
is.
I know you work a lot with so many different healthcare system clients and have for many years. So, and of course, a lot has changed. I mean, from before the pandemic to now, and kind of seeing that. Tell me a little bit about what you're seeing. What are
Yeah.
your clients working on, and where are these? What are the big challenges they're facing lately?
Absolutely. And I think all the clients we work with know, especially everybody that I've talked to, how much I'm invested in the relationship and their success. And every time we walk in, I always tell them, they say they learn from me, but I say I learn from them every single day. It goes both ways, right? And I'm just a lifelong learner. And I will definitely say that we are currently engaged with several clients on a range of projects. It could be helping them with really being their trusted partner and migrating them to a new EHR platform, or optimizing their use of their IT investment and enhancing that patient experience. But across all these efforts, I think there are a few consistent challenges that consistently present itself as opportunities to a lot of these healthcare organizations. I think the first one I see that's really big, and I think I've dealt with this even when I was a healthcare IT executive myself in the organizations I've worked with, is governance is one of them. It's quite a challenge and a debacle, really, to kind of make sure that, with so many, depending on the size of your organization, right? How do you ensure that the right decision makers are involved at the right times throughout the project, and we often find that streamlining decision-making processes across people, process, and tools and knowledge is a top priority. So effective governance ensures transparent communication. How do you get that communication horizontally and vertically across the organization so that you can manage competing priorities? Because, as you know, in today's world, more than ever, you have a greater demand than you do supply of talent and bandwidth. So that's always a challenge. Like, how do you have the right governance structure to help you focus in on some of your strategic assets, and where do you apply that, right? Then that comes to your talent as the next challenge. I think recruiting, developing, and retaining skilled talent remains a significant challenge, particularly in, I think, community health, rural health, and public healthcare systems. While we work with all kinds, different types of healthcare organizations, we also serve a lot of those segments within various healthcare organizations. And I think this talent gap can impact operations, obviously, innovation, and long-term success. So I think talent continues to be top of mind. I think post-COVID, right, as more people are figuring out what type of workspace are you looking for, fully remote, hybrid, back on site, I think people have learned that a lot of people want to be 100% remote in many cases. And it makes it even challenging for those who still believe in that high touch, stay visible and present, in the patient care organizations, wanting to people to come back. It just makes it a little bit harder to find that, right? Because now
Yeah.
I want to be remote, and I know I can be remote, and that's what I like because of their lifestyle.
Yeah.
I think data analytics continues to be a challenge. Organizations are now data rich, but finding the right ability to extract that data into meaningful insights and action are very important to that. And then I think about cyber attacks, right? Just unplanned downtime and disaster recovery. Helping people prepare for unexpected downtime, especially due to cybersecurity threats, is another area of focus. Robust business continuity plan, well-trained teams, and clear downtime protocols is essential when you're ensuring patient care and operations, are not disrupted or have minimal disruption whenever a disaster strikes. And then I'll just end with AI integration is another thing I see our clients kind of grappling with. It's become very integrated EMR systems, but there's so many emerging technology companies that are coming out around, AI and what AI can do for you. So I think there's a lot of hype around for our clients, and they're just grappling with, how do I pick the right product? What workflow should I consider to be part of this process, and how do I implement it successfully, and how do I measure the success? So I would say across all of our customers, those are some of the common themes I've seen across different clients.
Yeah, we're seeing those, for sure. I think the talent one, I think, is really interesting, and I think because
Mhm.
at first, certainly as the workforce went virtual kind of during the pandemic, and so, the scaling that was required and the work that was required was, it was immense. And then I don't know that it even occurred to us that they weren't going to come back at the same level,
Yeah.
right? And
Yeah.
because you
So
just
true.
think, and really it was a progression, it was sort of like, okay, we all went virtual. Okay, now it's hybrid and it's eventually going to come back, right? They're going to come back. Oh, wait, they're not, I mean, and I
Yeah.
think that's so interesting with a health system IT group, right? Where you've already got a little bit of like, are we really in this? Are we, how much are we part of this healthcare system? And then they're not there. They're no longer necessarily on premises, or they're not there as much. How are
Right.
you kind of helping folks, with that strategy? What are your recommendations? I mean, because obviously having them remote increases the talent pool. But in some
Hmm.
ways, it also increases the competition, right? I mean, because
Hmm.
now, you're not just, if you're in a rural health system and say you do have a few incredibly talented engineers and developers and project managers, well, now they could go work for, some other
Yeah.
organization. So tell me how your clients are navigating that, how you're helping them.
I think culture is the big thing, no matter what model you choose, right? Because I don't know that there's right or wrong. I think it's for your organization what is best for you as an organization. So when we work with clients, we really lean in to what type of model they like. And we just adapt into that from that perspective. So for example, when you're in a virtual 100% virtual environment with our team, we are pretty much 100% virtual. However, we comply with whatever our clients need. So a lot of them will be, we need you on site once a month. Some is like, we need you here all of the time. Some are like, nope, this is a 100% remote job. We totally support that. But I would say for the organizations that are 100% virtual, one thing that I've seen worked really well for us is just, camera on policy. It's very easy to multitask when you don't see what's going on. And so, like, I know even with our own company, I'm like, we're a camera on policy. If you can't be on the camera for some reason, I need a reason, justification as to why you're not able to be on camera, because things happen. And I would like to know that. But I need you to know that you're present, you're available, and you're engaged in this conversation, whatever that is at the moment in time, right? So I think instilling some of those policies. We also do a lot of virtual events. So like we'll do quarterly virtual town hall meetings. We do virtual happy hours, holiday celebrations. And then for us, in our company, we also have a couple events during the year where I bring all the leadership and core leadership on site to do some stuff. But you just get creative
Yeah.
with how do you stay engaged and active and promote that type of culture of that high touch you don't get. And I know one thing we do very well at Elite too is, you probably know this better than anybody, Megan. Part of my role is traveling to visit our clients. And whenever I'm visiting our clients, I mean, that's where my inspiration comes from, is really I'm inspired by people. Anybody who knows me, like, I just love meeting people and spending time with people, because I think there's so much to be said about seeing the talent and what motivates people, what inspires people. Like, I just love being in front of that, building that relationship. And so when I do travel and go see my customer, I'm always like, we have staff that practice over 30 states. I will say, hey, I'm in town. I get a report who's all out there, and I make sure I spend time with them so that they all come together. So we do that throughout the year. And I think that's really gone a long way. But I do think, culture is a really big thing. And as a result, we've had a really good culture. We have really high employee satisfaction scores here. And our retention rate is extremely high here at Elite Groups. So
Mhm.
I think you got to like continue to foster that culture of engagement, that you're engaged, you're invested in their success, and that they are part of a bigger team, and we're all part of a greater purpose.
Yeah, I mean, and I think it's so important within healthcare because, resources are tight, salaries aren't as competitive as they are in other technology, areas. So if you don't have that culture and you can't, engage your teams, you're going to lose the resource.
And we're in a high touch environment, right? Patient care
Mm-hmm.
is a high touch environment because you're talking about the human empathy and understanding, people come to see you, whether it's a wellness check or, they're coming to see you and they just got delivered a diagnosis or prognosis, that's just life changing and life altering. In fact, I will never forget Dr. Mava Beverly, is a good friend. And I worked with her one time. And I will never forget this question she said to me, Megan. She said, Pam, across any industry, what is the one thing in healthcare that you would say, regardless of your gender, age, race, etc., that you share across the world? And I struggle with a lot of different words. I'll tell you, I tossed up a couple of words to her, and then she said, no, it's in healthcare. If you were handed a prognosis and they're like, you have breast cancer, as an example for me, you can't change that diagnosis and prognosis at that time. You don't have a choice other than what does that program look like and what does that journey look like moving forward. And she said, think about it. You go to a restaurant, you don't like the food, don't go back to that restaurant. You don't like the hotel change, we'll change to go to a different hotel, right? But when you get handed that, Pam, I'm sorry, you have breast cancer, you can't change that, Pam. Mm-hmm. And that really, resonated with me because I'm like, absolutely. And that's why we're part of their journey at that point. Mm-hmm. And you want to make it the best journey they will have in that process.
Yeah, 100%. And it's so important as you go through that. And I think and that's why that in-person connection, the relationships in healthcare, whether it's between partners, vendors and the hospitals and health systems, obviously the relationship between the clinician and the patient are so important. And, I think it's such a huge part of it. And that's, what we love to do is kind of bring people together. We didn't make it to Epic UGM, but I know you were there in terms of, what was going on and some of the stuff. I imagine there was a lot of discussion around AI integration and what people are doing. Tell me a little bit about some of the solutions you saw there and how they're, kind of.
No, I really enjoyed it. There were like top 10 and I probably took away, out of the top 10, I'm like, here's 5 things I'll focus on, at least for our conversation. One is business continuity, which I talked about opportunities across the organization. I think we're all looking at the lens of just cybersecurity, right? And how to protect us, and making sure we have a resiliency built into that. But I think for business continuity here at Ellit Groups, one of the things we are proactive about and we really think about is that, we understand that recovering from unplanned downtimes in hours versus days, is really critical to the healthcare operations. So we offer a very comprehensive program to help organizations strengthen their business continuity plans. And that includes ongoing refreshers to ensure that when a downtime occurs, teams are well prepared to implement the protocol seamlessly and effectively. Because if you don't keep that practice up and it hasn't happened to you, when it happens, you just naturally don't have that instinct to trigger all those components to operate, right? And be able to put those policies and procedures into play. So we do provide a comprehensive program that goes through your downtime policies and procedures, really doing the round tabletops and making sure it stays very current and relevant in your life. So when it happens, because we don't know when it happens, that you're able to move into that as a natural order in process. So I think, that was one of the takeaways, like how do we help organizations get to a place where you have such a robust plan that you can recover in hours and not days or weeks or months in some cases, right? So I think that's really important. And I think here at Ellit Groups, that's one way of us being able to address something like that. The other thing you talked about, AI. One of the things they talked was how do you embed AI into your strategy, into the workflows that you use every day? So it's not this new product you're trying to bring into, right? But making it a seamless part of your work. So I really think as healthcare organizations face the influx of these emerging technologies around AI, determining the right fit and strategy can be extremely challenging. And I know that UGM, they listed all the different areas where they've provided that, AI integration directly into the workflows. And I think that's really robust in terms of what they do. So for us as a consulting organization for a lot of these, so we bolster that, right? When we're there, we're like, listen, these are all the functionalities we want to be able to turn on. Let's make sure we have a good plan. Since we're a service provider organization, we provide services to help you put a good plan and methodology in place to stage and roll these changes in an effective manner where we can measure and monitor the success of these changes, right? And make sure that they stick. So that's one thing we're certainly doing in AI. In fact, we're working with a client to help them with how do we make decisions around AI through your governance structure. How do we prioritize those? How do we stage out those rollout features and functionalities? And how do we put together a good implementation methodology and plan to implement those? And then how do we measure and monitor progress, right? And as we move forward. So that's certainly one thing we also took away. And then unlocking ROI with shared goals. A lot of times people want things and we don't really take time to evaluate your ROI behind it, like what's your business case or what's the business case you're bringing forward. And I think here, we have a dedicated department in our organization that focuses on performance improvement and informatics. So we help organize, build out their ROI strategies with 5 to 10 year total cost of ownerships. We also assess their current KPIs against industry benchmarks and target KPIs, really helping them to reach their full potential and drive value for their IT investment. So, that's kind of like, here's things I took away. And I'm so glad we have these services that we can align perfectly and be able to bolster that message. And because together, I think no matter which, organization you serve or whoever is pitching it from a conference standpoint, we're all about patient care and patients at the center of everything we do. And so when I think about that, I'm like, how do I help make that change? And how do I help bring that great impact here at Ellit Groups, right? Or enhancing patient online access. We recognize that growing importance of improving online patient access. I know as a patient myself, let me tell you, from a primary care physician, it takes me 4 to 6 weeks to even get to them. I have to go to urgent care, and go in the waiting room, wait in urgent care. I have to find out which urgent care has the least amount of waiting time so I could go there. So we need to find ways to automate that process and improve our ability to get access to care and be seen when we need to be seen. So, we actually just invested in a digital VP of digital patient experience, and we have a division because it's a growing line and we're seeing a great demand for that is really addressing the need through comprehensive program, including from the scheduling point to the patient service desk to proactive outreach to the patients and ensuring that seamless experience for our patients seeking care. So those were some of the takeaways I did when I went to the conference. I'm like, how are we as an organization, Ellit Group, providing services that complement driving those results for the shared customers?
Yeah, well, it seems like you guys have it covered, and it is, it's always it's such an amazing event, and it's so fun to watch what they do. And they're, as I've seen so many organizations have more and more user groups meetings and get bigger, but they really, they sort of cornered the market and have such a great one every year. And I love seeing the news that comes out of it. But I know you mentioned data analytics, and I know I had the pleasure of meeting the team at Heart at HealthIMPACT. So tell me a little bit. I saw that there was a strategic partnership announced between you and Heart. Tell me what that looks like and what that means for your clients and everybody.
Yep, for sure. Well, so I got to tell you, Megan, you got to love the word heart. When I saw Chris, I'm like, I heart you, Chris. But no, all kidding aside, at the heart of everything, it's always about the patient. I think at Ellit Group, we partner with different organizations. So you always go through your strategy. Like, do I want to build this? Do I want to buy this service or product that I don't currently have as my core competency, or do I want to partner with somebody, right? And so certainly, we work with a lot of clients where we're helping them do system selection around what's a good data migration path for them, what makes the most sense for them as an example. And even previously, when I was healthcare IT executive, I was the one on the other side choosing some of those solutions. And I think there were some things that were always top of mind. Every time I pick a solution or we try to do anything around data conversion, data migration, always took a lot of time, cost us a lot of money. And sometimes I'm not sure at the end of the day, did it bring the value I want or the quality I wanted? And so when I started evaluating the Heart product, it took a little bit of time. And I know the people at Heart who actually created and developed a lot of this, I was really impressed that it met all the workflow needs we come across with our clients and meeting their requirements. And in doing it, it was faster, more cost effective, and it delivered high quality results. And so for us, it's not a tool we can build or buy. So partnership strategy meant it was the right fit for us. They bring the product solution. We are a professional service delivery kind of organization. We specialize in integrating solutions with operational mindset and helping people put together robust implementation plans. And they're very rich in some of their EHR clients and very rich in a different EHR client product. And so together, we really kind of expand our footprint in terms of the number of customers we can serve together, by combining both of those. And, also it's like a one-stop shop for us in that area versus going out and sourcing for different, partners or vendors, as an example.
Yeah, we're hearing a lot about how health systems want, they want, things in one place, not a lot of point solutions.
Exactly.
And integration. So
and just being a good trusted partner, working around trusted relationships and people who share, the same culture and values. And that's what I like about Heart. Obviously, I'm always very intentional about things like that because your values and your culture is not something I compromise when it comes to patient care. And so they put patients at the heart of what they do. And so that is something we also have in common. So it's been a good partnership. They're good people.
Yes. Well, I'm excited to see what comes of it and to work with them more and to see, how both of you can amplify the work on both sides and amplify the great things that you're both doing. Speaking of that, earlier this year, there was also the news about Lumerity Capital. And I'd love to hear how that's going and how that aligns with your current strategy.
Yeah, no, I'm very proud to have Lumerity as our partner for Ellit Groups. I think everybody knows when you're building your own company, that's your baby. And people say you don't ever want anybody to call your baby ugly, but you also have to be willing to listen, right? And for me, it was always so important that whoever we pick, it was somebody who aligned with our culture and value. And most importantly, they believed in our brand and our playbook and what we did really well, in respecting and honoring what got us here as part of our DNA is what's going to get us further. And so I was looking for a partner who would really help, invest in us in our ability to grow and scale with quality and not compromising quality. So it took quite a bit of time, while the decision came overnight or so through press release. That process itself took probably a little over a year because we courted for a long time, wanted to make sure we were really in alignment on what I saw the company continue to pursue. So anyone who actually has built their own company understands that it does come a pivotal moment when pursuing a strategic direction becomes essential for your growth, right, and scaling. And so this approach really enables us to effectively grow while we're maintaining our commitment to quality. And I think what's really important is we've been now together for about since June, so 4 or 5 months. It's been a great partnership. They are great advisors. I can reach out to them for things. They give different perspectives on certain things based on their other portfolio companies that we can learn from. And they've been extremely supportive. And I think as they get to know more and more of us, I think they really appreciate us even more than they ever had to realize what's special about Ellit Groups, which is our brand is always about putting patients first in everything we do. While we're a healthcare IT technology company, we don't go out and use acumens in selling technology. Like you'll never hear me talk to our customers about any acronyms in IT. I'm talking about their rural operating issues, right? What is your access to care? How long does it take for your third next available appointment? Let's talk about what that looks like. How can we help you improve that throughput, right? So, we really come to them in problem solving through business solutions versus technology. And I think they really appreciate that. So they've been really good partners. I've been extremely pleased. They share good values and culture with us. And I think they're very happy with it too. And as always, people was worried, right? Like everybody, like I was too, that if you get a new, PE company or something comes, that your brand's going to change. You're going to have to go after certain margins and you're going to dilute the brand, or you're going to have to grow so quickly that you can't, all the growth we've had in the company and what my projections are for Ellit Groups over the next 3 to 5 years, they've been part of our plan. It was just them looking at the plan saying, that looks really good for us. And they bring in some, different partners that maybe I didn't think about for certain aspects, whether it's, looking at different tax advisory, CPAs for our organization, or looking at, different firms that do banking with, they bring a lot of different, insights to that has really helped us to kind of look at different things too. But I respect them and I think they respect us. And people used to say, Pam, are you still going to be the CEO? Will you keep going? As long as it's Ellit Groups, I will keep moving forward. And this is our company, and I will continue to be the CEO, operating it and running it with our teams.
Yes. Well, and, I think that, as where we started the conversation and your, focus on the human element of healthcare and leading both your company and helping your clients through compassion. And as you just said, that focus on not the, technology acronym or the shiny object, if you will, but the problems in healthcare. And I think that's so much of what, when I go from meeting to meeting, whether they're my own or others, I get tired and frustrated by us just sort of talking, preaching to the choir about all of that, instead of getting to, there are just so many little problems, low-hanging fruit operationally at every organization. We've talked a lot about getting rid of the stupid stuff and all of that, those little, approaching the technology and the innovation process in healthcare through that lens is so important. And I know that's what you and your team at Ellit Groups does so well. So we're running out of time. So, and I always ask, around like, what's the one challenge or what is the one good thing? So I'm going to let you choose. If you want to talk about the good thing that you think is happening in healthcare, or if you want to kind of close on, what's the one thing that you would like to see fixed in the next,
Well, I think one of the things I think about is, and actually you asked me this, right? Like, leave us with one good thing happening in digital healthcare that makes me excited for what is to come. And I think if you kind of look backwards from my origination of where healthcare technology was in my early stages of my life, channeling, supporting my grandmother through her integrated medicine in the Laotian community, I look forward to today and the future. And I think I'm really excited because things are only going to get better, And for me, what I mean by that is we now have access to powerful tools with EMR, which we didn't have even more than a decade plus ago, right? 20 years ago. We talk about cloud technology, we talk about AI into our life and all of these things, right? And all the devices, that hook up to us and how we can monitor ourselves at home. You just think about all the emerging technologies that improve the patient experience and empower patients to care for themselves and enable and empower us to take care of ourselves, right? I think about me, the patient, from that particular perspective, they're all transforming healthcare. And I look down the road and I can envision a future where I can say, Grandma, I have helped leave the world in a better place. Your community and the countless others will no longer have to rely on a single person just to navigate their healthcare journey. That instead, they're going to have access to the care and resources they need whenever they need it. And for me, that's just something I can't wait for, and she always like, you want to leave the world in a better place than you came into. And I just think there are so many countless heroes around the world that choose healthcare as part of their careers. I made it, but we all do it because it's a very humbling career to know that while I may not be a person bedside taking care of that patient, I know somewhere in a small way I was able to help influence and make the world a better place and leave some positive impact. And so I just think all these smart, creative, talented people coming up with these amazing ideas. I love that Ellit Group is a service provider. We don't develop, product solutions, but I love being able to focus on the act of delivering services and providing those services. So that's what I would leave you with. I just think we are in such a great place and that we'll continue to. Are there challenges? Absolutely. But every challenge is an opportunity. And we have so many talented people in this world that putting patients at the center of our heart motivates and helps us push our boundaries to continue to make healthcare better.
I love that. And I know that you do that. And I know you take it to heart with everything that you do. And I think, and that's what technology is, the tool and the bridge that is connecting patients to, care that they can't get and, improving that care. And it's such an important place to be and an important time. So
yeah,
I really appreciate
and Megan, you know the name Ellit Group better than anybody else, so I'll leave you with one final thought because I think this is important for everybody to know. Ellit Group's name was very intentional when we came up with that. ELLE is for the French word she. It really channels my grandmother, who was a pioneer back in her days. So every single culture and value that goes into this company is really about that hard work, ethics, putting the patients at the heart of everything we do. So L is French word she, and that is her legacy for us, right? Drop the word E. IT is exactly what you just said. Technology is to be an enabler and a catalyst to help drive operational efficiencies and help operations find those competitive advantages for them when it comes to taking care of patients. And groups is about nothing is successful without being able to collaborate across, people, vendors, whoever you need to collaborate with. No success can be done without that. You think about healthcare. Continuity of care requires care coordination across different people, no matter what role you have, from the scheduler, right, to the MA, to the PA, to the provider, to the nurse. Like, we all have a role in this whole equation. So that's what group stands for. And it is pronounced elite because we want to deliver the best results with the best talent to bear. And that is what Ellit Group stands for when it comes to the name of our company.
Amazing. I actually didn't know that.
Oh, really?
I didn't. And that's amazing because, of course, that's what we're all about here too is, I think it's, it speaks so much, obviously your story, with your grandmother but women are, in so many ways, the drivers of healthcare and making family choices and all of that. So, what a great name. I mean, I just thought it was because you were elite and amazing and the best.
Well, I appreciate it. I'm sure that's a little biased, but thank you.
Well, Pam, thank you so much for joining us. We will for sure talk again soon. This has been just, it's always a delight to have you on the show and to talk and to hear about the work that you're doing. So thank you. And thank you to our listeners. You know how to find Pam at Ellit Groups, and she's on LinkedIn as well. And always, at our events at HealthIMPACT. So
that's right.
Until next time, keep pushing boundaries of what's possible in healthcare. I'm Megan Antonelli, and this has been Digital Health Talks for HealthIMPACT. Thank you.